Have you ever been in an operating room before? Let me give you an inside look of what a typical operating room is like for a spine surgeon that does complex spine surgery. First, we have the bed. There's many different types of operating room beds. This is a 4-post Jackson. So the patient will be laying down flat here, have their chest here, face here, and the arm boards there. There's padding on all the pressure points. We have screens, so during the case, we can be looking at the patient's anatomy as well as the x-rays. Speaking of x-rays, most ORs have a fluoroscopic machine. This is essentially an x-ray machine so that we can see the patient's anatomy as well as placement of our hardware. We have this device called a NEPTUNE. This is what sucks up the blood as well as fluid. A device that does cautery, helps burn the tissue and control hemostasis. We have a surgical microscope. Most surgeons don't use these for every single case. There might be certain cases such as cervical fusions, discectomies, or minimally invasive cases where we'd use a microscope. Up here is where anesthesia plays Sudoku. Additionally, they'll also be checking the patient's blood pressure, monitoring, and other things that are very complicated to me. They have their cart, which is where they're always getting supplies. Another thing most people don't realize is during any surgery, there might be up to 7 or 8 people in the room. These are different nurses, reps, vendors, anesthesiologists, PAs, and the patient. These are the tables. Now there's obviously nothing on them now, but as you can imagine, these will be covered with blue drapes and have all the equipment on there. In the back of most rooms is a table where we can leave supplies. The reps will also usually have their computers there and be counting their money during the case. We also have lead. This is something we use to protect ourselves from the harmful effects of radiation that we might need to be using during the surgery. There's different supplies that are usually on the wall. That way the nurses aren't having to run back and forth for additional supplies that we might need during the case. This is the nursing station. This is where they can check the status of other cases. They can also be charting about the progress of the case and be checking things as needed. Outside one of the doors, you can go into the sterile corridor. This is where most of the supplies are kept. You can also enter into another OR. You can see this OR has the same setup. Consistency is a big deal to avoid errors in medicine as well as maintain efficiency. We have a nursing station, an anesthesia portal where they have their machine, all their equipment. Again, another orthopedic or spine bed. We have our lights, our screens, our x-ray machine. I'm here on a Sunday rounding, so tomorrow's cases are Monday. We have the cases already pulled and ready to go for the following day. Our lead, and if we walk out, we have our nursing station. It's one of the most important centers of any hospital system. Our scrub table, and going right back in, our operative theater. Now that you've seen 2 ORs here, what are some questions? What's maybe the next topic that I can tell you about in terms of technology or minimally invasive equipment that we use on a day-to-day basis?